Today we are going to talk about ADD, or now it's rather known as ADHD, and we have Dr. Edward here to explain to us what is it all about and how we can treat this with various types of treatment, okay, to treat this ADHD. Okay, so now we would like to open questions. Anyone?
Right. So before that, we would need to define what is ADD, ADHD. So the traditional term for this was ADD separate from ADHD. In fact, if someone can get me the book from Daniel Amen with the 7 types of ADD, please. All right. So according to some original investigators like Dr. Daniel Amen, there are like 7 different types of ADD, ADHD. But now the tradition has shifted to ADD stroke, with the H, stroke. All right. So thank you. So this is a good book. I am actually licensed by Dr. Daniel Amen, who is a best-selling author, and he received the American Psychiatrist Award. And there are the different types of ADD, ADHD is listed in the book here. Like the classic one is inattentive, distractible, disorganized, hyperactive, restless, impulsive. This is more like the AD with the H. Or you can be just distracted, low attention span, but not hyperactive. You appear sluggish, apathetic. So that is like another type. It's called the inattentive ADD. Or you can be the over-focused ADD, where you have excessive worrying, argumentative, compulsive, locked in negative thoughts, right? So that there are like different types according to different regions of the brain. So that is according to Daniel Amen. But there are other authors like Buckley, right? Dr. Buckley, you can look him up, and his view, according to his research, is mainly the executive function of the brain. All right. So when we do some of the tools that we use as an educational psychologist, we use a tool called Weissler Intelligence Scale for children. All right, depending on whether the child, the patient is a child or an adult. So ADD can affect adults as well. So if you, we can also have a cognitive assessment for adults called the Weissler Intelligence Scale for adults, version 4 now that we use. So we can then look at all the function, the cognitive function of the patient. And for the ADD patient, their normal functions can be quite fine. The IQ can be quite fine, right? But there are certain tasks which require the executive function, right? So the Tommy, if you're there, you can do a screen share or showing the 7 types of executive function. So there are different executive functions, right? That we have, which can be impaired. And with ADD, it is typically this executive function that are impaired. That would result in a lot of the dysfunction affecting children and adults with ADD, right? So it's very specific to executive functioning, right? According to some investigator like Dr. Buckley, for example. Yes.
Doctor, what you were explaining to us about ADD. Are there different types of treatments?
Well, one of the most common treatments. Well, there is a pharmacological treatment, all right, and behavioral treatment.
Okay.
Right, and here what we certainly know that there are the what we call neurotransmitters imbalance. All right, if someone can get me the Juanita's book, right, The Alchemy of the Mind, and in fact you can read out a very good colleague of ours who is a consultant for the lab that we run as well, you know, WellLab, has written a book, documented different chemicals in the brain. All right, so one of the key chemicals called dopamine is normally found to be a problem for ADD, ADHD patients. And dopamine is like the top neurotransmitter. All right, there are other neurotransmitter downstream like noradrenaline, which is also affected. You know, and I will read you a copy of the relevant page of the book, which shows you what are the key functions. But basically, dopamine is responsible for attention, right? Attention, motivation. So all this may be deficient, right? And we can easily test for that using a urine test. In fact, Tommy, you can show the screen share the results of one of your patients, you know, with low dopamine, you know, showing that that you have, and so you can see what that looks like. You know, you can also go to the website for the lab, malaysialaboratory.com, and we have sample reports there of the neurotransmitters. So one treatment option could simply be boosting up these chemicals. Yeah, okay. Dopamine, noradrenaline, and you probably heard of drugs like Concerto, Ritalin, you know, very infamous. It hasn't changed for donkey years, you know. These are stimulant, you know, boosting up dopamine, noradrenaline is stimulant. So coffee is the same thing, you know. You are stimulating, boosting up all these so neurotransmitters have two classes. You have the active one and the inhibitory one, right? So basically, some neurotransmitter act as brake, yeah, that will stop you from doing things. Some you know, give you the motivation and energy to do things. So you need to have both. Now we can see you, Judy. Fantastic. So that might be multiple levels. All right. So in Aman work, he will actually do a brain scan, you know, and he will look at different parts of the brain, you know, in his book. And I've been to his clinic, and that's where I learned all this technique. And you can, he would actually, to do a brain scan, he has this big machine you go through, and he will see that there are activities level that are not functioning, right, in the brain. And that's why you have all these holes. These are not like literal holes. It's just as under functioning areas of the brain. So but here we have the neurotransmitters, which is the same thing, you know. So we can measure different neurotransmitters, and that's why we have these different classes. Maybe you don't have enough GABA, right? So when to get the book, I will show you. Like GABA is what we call inhibitory neurotransmitter. It gives you the break, right? So some people do not have enough GABA. That's why they cannot stop doing things, that they keep on doing things. And Judy, you know, you and I, we have been working with ADD child, right? Recently, and this guy, you know, if you remember, he will keep on saying all the swear word, You know, he said fuck, right? I keep on saying fuck all the time. He cannot stop the F word, you know, and yeah, and that because he cannot stop. Thank you. It's not that he doesn't know it's wrong, right? He cannot stop himself because he doesn't have the break, right? So here, so this is the book, you know, if you want to learn about simple biochemistry, it's called Alchemy of the Mind by Vanita Dahir. And it give you all these, like, you know, when GABA is low, right? When GABA is low, you might feel anxious, overwhelmed, you know, fearful, disorganized, incessant worrying, inability to relax, you know, panic attacks. So these are all typical symptoms of the ADD, right? But part of one. But you can also have dopamine, you know, when dopamine is low, you have lack of energy, you know, low, lack of motivation and satisfaction, right? Mood swing, obsessive compulsive disorder, you know, memory loss, addiction, inattention. So that is could also be dopamine. So I'm a trained nutritional therapist, you know, psycho-nutritional therapy. So we prefer to increase, well, we prefer first of all to do an investigation to identify specifically which one is low, right? Is it more the dopamine, the noradrenaline, or you know, and if it is low, it's not a simple, so it could be because of the precursor, right? That is low. So by precursor, I mean all these things have building blocks, like dopamine get built up from something called L-DOPA, right? It's a precursor. So L-DOPA would need something to convert it into dopamine, some enzyme, right? So some enzyme called COMT, C-O-M-T, you know, it's a specific enzyme. So the problem is, some of us, right? We don't have like ADD gene per se, right? Where so far no one found one single gene that is like a, you know, you have this gene, you have ADD, but we have a number of things that can genetically that can give rise, right, to ADD, like your COM, which is the enzyme to convert the L-DOPA to dopamine. It could be an overactive, what we call upregulated. So it's working too fast, right? So the dopamine need to be broken down as well to the metabolites, all right? There are different metabolites like HVA, VMA, you know. So there are different metabolites downstream that needs to be broken down and then need to remake, right? So some of these can be working too fast, so the COM can be overactive. So if it is working too fast, so that's why you don't have enough dopamine, because it's like you are having a bath, right? And the hole is too big, or the water comes out without, you know, you have to slow it down. So you can take a supplement from green tea called theanine, which is just blocking, slowing down, you know, the breakdown.
Okay.
Yeah, so it can be but we need to know where the problem is. So that's why we have this test called the neurotransmitter test that can see whether your enzyme is upregulated or the precursor not enough, you know, if indeed your dopamine is not enough. So that could be different reasons. So this is the physical part, right? Okay. of the treatment. And here we recommend a holistic treatment. Okay. Because so, we are not just a brain, we are not just mind, you know, we are brain and mind, and the two are intimately linked, right? Just like a computer, you know, is it a hardware problem or a software problem? And when the computer doesn't work, it can be either, right? When your camera doesn't work, right? So
something has gone wrong.
Yeah, something has gone wrong. We need to know exactly where the problem is, and most likely in psychology is always both, right?
So instead of diagnosing it yourself, you need to go for this relevant test to
Yes,
actually pinpoint where the area
that's
is.
right. That's
Yeah.
right. You know, we can have this DSM-5,
Yeah.
right? This Bible that we have, and they will give you a list of criteria, you know, and someone can read out what are the criteria for ADD, ADHD, you know, there are like a few criteria, but these are very superficial diagnosis. It's just like you know, give you a list of symptom. It doesn't tell you
On
what,
paper. Yeah.
yeah, what caused the problem. So you need to do some of these more diagnostic tests, like the WIS, Wechsler Intelligence Scales for children. Now we have the version 5, or the Wechsler Intelligence Scale for adults, right? So when you do that, then because it looks at all sorts of cognitive abilities, right? And so the person with ADHD do not have a low IQ. I mean, if you ask also our patient that we know, that we work together, Judy, he hasn't got a low IQ. He can do most of the
Intelligent,
stuff.
yeah.
He's very intelligent, right? But there are certain impairment, certainly that is very specific. Okay, so this what we call specific learning disability, right? It's affecting his learning, but in a very specific way. It's not because of low IQ. So this is how we can So just now I was talking to our lecture group, and all the word I'm looking for is differential diagnosis. Okay, so we can do a differential diagnosis, right? So this is how we can differentiate the diagnosis from ADD, from dyslexia, from ADHD, you know, from other disorder, you know, specific to ADD, and here we are looking a lot at executive functioning, executive functioning, working memory. All right. So they are like if someone can show me a screen of executive function, you know, there are like different types of executive function. So executive function, you need to realize is also, although in the WIS and the Wechsler we don't measure as such, but it affects your emotion as well. Okay. One big thing it affects is your ability to tell time. All right. So that is why with ADD, ADHD, yeah, organization skills is very poor. All right. They have no concept of time, because with the executive function impaired, you cannot plan, you cannot, you know, time is not relevant for you, you know. So there's hence the impulsivity, right? So impulsivity is the what is causing you the inability to plan and tell time, right?
Okay.
Yeah.
Doctor, will they be, with all this treatment, okay, will the child, if we are talking about young children, will they be able to outgrow it, or how?
Well, that definitely not, right? So they will not be able to outgrow it per you know, on its own, and if you you can learn skills, right? Certainly, as you know, as a child, there are a lot of skills we need to learn. But and that's why, you know, we have all these apps, or all this computer, and even as easy as a diary, you know, we can you know, we can use. So what we need to do as a therapist is to provide all this external resource. You know, how do you use a planner, how to use a diary, a calendar, you know, to help you plan. And this is why now, you know, if We have for this child. Maybe Judy, you want to give a short background about this child we were seeing, so that everyone knows a little bit of background. What is the problem?
This child, you know, he's 5-year-old
how old?
boy.
5-year-old, yes.
5-year-old boy. He is hyperactive. He's constantly doing things, you know, constantly doing this, doing that. He cannot concentrate on one for a very long time, so he will move on to something else, you know. And then he doesn't do his homework till the last minute. You have to coax him, or you've got to, you know, keep reminding him. Then the last minute he will do it. Okay, and then he has got this habit of showing tantrums outside in public, where he I think, you know, children, you know, when they don't get something, he will actually really start showing tantrums, you know, attracting all the attention from others. But I don't know whether he actually doing it for attention of others or the parent. What do you think, doctor?
So this is the problem with you know, with the people with ADD, children or even adults, right? Many people feel like this is you know, they want to judge, they want to make a judgment, you know, that you are naughty, you know, you are you know, immoral or something, right? But many times it is, you know, it's not because of that. It is you know, they cannot because they are lacking in this executive function, right? So then yeah. So he doesn't have the ability to put the brakes on, right? No doubt part of it is the pleasure of doing things, you know, when he said his words, and he, you know, he can see that the adults give some attention to him, you know, then that gives him some satisfaction, right? So that is only part of the story. It is not the main story. All right. So definitely part of the behavioral intervention is we need to tell parents not to reinforce this dysfunctional behavior. You know, when they said this, the F word, you know, and when he does some disruptive behavior, not to reinforce it. Yeah. But that is only part of it. But we also need to understand that he might not have the full capacity to control himself, right? So we need to give him some help.
So talking about this boy again, but he was quite controllable, right? When we started giving him rewards and singing with him, he became quite you know, receptive, you know, to listening.
Yes. So the you know, so Judy is doing the music therapy course, and that's why we work with her on the music therapy with this child, and that has certainly worked. You using songs and things as a way to control his behavior, right? So yeah, so it's like a ritual for him. You know, he has a structure. So what he needs is structure. So songs provide a structure for him, you know, with the instrument and all that, you know. So what he needs is a lot of tools, you know, external tools, because he doesn't have much of the internal tools that children normally have, right? So therefore he needs some of these external tool like music, like a planner, you know, like a reward system to remind him, right? So that is the behavioral therapy that we can do, you know, in addition to the supplementations and things that we can provide for him. Yeah.
Doctor, you have seen him the little boy now. How has he progressed with the supplements and with all this?
Yeah, so we have sent his urine to be tested for the neurotransmitter. We have not got the result back yet, have we, Tommy? The results have not come back. Oh yeah, the results have come back. In fact, we have the results. So Tommy, can you like share, blanco out the name and share a copy of the results? So indeed, the dopamine is very extremely low. We will show you in a minute. The dopamine, the noradrenaline, these are like extremely low. This really confirm, So in a way, you can liken an ADD child or even adult with someone with like me who is short-sighted. So all we need is a prescription with a pair of glasses, then we can see, right? But the problem is, especially a big problem now we have is adult ADD. A lot of adults that don't get diagnosed until they're in their 30s, and then they have spent the whole life, losing jobs, having failed relationships, all these problems that can be avoided if they have a diagnosis earlier on, right? But because they did not, so they have all these additional psychological issues of depression, anxiety that is going on, that we as therapists we also need to attend to. But all this is secondary actually to the primary underlying disorder of ADD, which can be easily corrected. If it has been diagnosed and treated, it might be a simple matter of just raising the dopamine level or noradrenaline level, right?
Okay.
Yeah.
Doctor, you're telling nutrition. Okay. What are the food kind of? Is there the specific food that the child can be given to increase?
Well, yeah. So I've got this nice book here. So I recommend this for everyone. This is by the Dr. Natasha Campbell. So it's called Gut and Psychology Syndrome, and you can see ADD, ADHD here, all right, as part of the pillar. So there's a big connection between gut and brain, all right.
Yeah.
So now we know
brain, right?
we call the gut as a second brain. All right, a lot of neurotransmitters actually are found more in the gut than in the brain. All right, so like serotonin, there are a lot in the gut. So in terms of nutrition, we need to take care of the gut. All right, so the gut has something called permeability. That means it has very small holes. All right, very fine pores. Right, permeability. Yeah, so this is the intestinal permeability. So it plays a function of absorbing nutrients and also protecting, you from all the toxins. All right. So now if you eat the wrong type of food, namely sugar, right? It will lead to an overgrowth of bacteria, yeast, candida. So there some of these like candida that have like roots that penetrate deep into the gut lining, causing enlarged what we call intestinal permeability, compromised intestinal gut permeability, and lead to a condition called leaky gut. So if you go to our website, malaysialaboratory.com, you can see there's a test that we have called the Leaky Gut Test. So what this does is we just give you or the child a solution called mannitol. Is harmless, but it has very large molecule. And then we take some urine sample, 6-hour urine sample, and we can see how much mannitol is absorbed. If it's more than normal, that means you have a leak in your gut. That means the holes become large. And when you have a leak in your gut, you cannot absorb nutrients, right? So that is why all this gut problem leads to brain problem. Leaky gut leads to leaky brain. All right. So yes. So what we recommend And I myself adhere to this. You know, is the ketogenic diet, right? So some of you might know this, but the ketogenic diet basically inverts the food pyramid. So traditionally in the food pyramid, you have the base, which is carb, right? Rice, bread, pasta, and then you have the protein, which is like 17%, carb is 80%, and then your fat is like 3%. So we turn this over the other way around. So the most of my diet is fat, right? And protein is normal, but carb is kept below 3%. So I don't eat rice, I don't eat bread, and definitely no pasta. I enjoy all this, but I discipline myself not to do that, right? So the brain needs a lot of fuel, no doubt, all right? But there are two sources of fuel, either from sugar, right? Which is where most of us do that, but this is not where our ancestors get the fuel, the source of fuel, all right? So the other source is ketones from fats. Our ancestors, that go back to thousands and millions of years, are actually hunters gatherers. They are not, planters. They are nomads. And some people in Africa are still doing that. They're nomads. They go from place to, they don't grow wheat or rice and eat wheat and rice every day. No, they go and catch a mammoth, and then for that they feast until they run out of food. Then they go hunt again, right? The woman will gather a few nuts. So this is our diet for millions of years. So we are not adapted. So our biology haven't changed, but our lifestyle, have changed to McDonald's and Kentucky Fried Chicken and all this, which is totally create a big problem in our gut and brain, right? So ketogenic diet. So we need to do a few switch, right? From the sugar to ketones. Yeah. So this is like you are doing the fuel switch for your car from diesel to petrol. Your car cannot run on petrol if it's on diesel. You cannot mix it up. All right. So the only way our body can switch to ketones is we keep the sugar below 3%, and then we will automatically switch. It might take a few days, some weeks, but you switch. This morning I played tennis, on an empty stomach, full of energy, because I'm using ketones, right? My last meal was like 6 o'clock last night. I have like every day a 15-hour fast, but this fast enable me to utilize all my ketones. I eat a lot of fat, 80%, but I don't, see, I'm not fat, right? Because my body burn the fat, the ketones, my brain utilize it. Yeah. So this is the diet we recommend, right? So that's why my gut is very healthy, and then my brain is healthy. This is the ketogenic diet, and we are talking about ADD now, but this diet have been used to cure Alzheimer. You can Google up Mary Brown, I think. She used it to cure Alzheimer of her own husband. No, Mary Newport. Sorry, Dr. Mary Newport. Who used the ketogenic diet. And you can Google up ADD and ketogenic diet, and it's all out there. So diet is a big thing. Yeah, it is the guts, the sugar. You just give sugar to the kid, you see that the hyperactivity go up. No time you can watch it, right? So you need to. So the problem with the sugar is go up and down. You eat bag of sweets, ice cream. You're full of energy, then you crash, and then you go and to another fix. You become addicted to it. Whereas on ketones, you never go hungry. It is stabilize you and give you energy, for the whole day. So we need to switch back. But hence the problem, you know, to the big problem is sugar addiction. You know, this is like another topic for another day. But it is very difficult to overcome. You know, and so when your child have ADD, you try to, you know, this is a fight parents need to do with the children to really say no. So most parents cannot do that. You know, they empower the ADD of their children. They empower the addiction of their children. You know, they cannot say no to to the ice cream, to the Coke. You know, and so that become a negative cycle. But you have to, you know, you cannot fight about everything. So you need to choose a battle. You know, choose one or two things, and you have to put your foot down and say no. You know, you have to fight that, and until the child is have no choice, is hungry, but they have to take the healthy food, right? But the child will fight you, and it's not easy fight. So that's why if you treat it early, it's easier. When the child become a teenager, it's like very difficult, you know, because you have to change the diet and all the behavior. Yeah, but it is possible, you know, and maybe you can, because the ADD child is you know, is intelligent. So if you can recruit the child to cooperate with you, that's a good thing, you know. So you need to work on that. Yeah.
Okay. Do you have some more time? I've got one question. What do you call, in schools, many teachers, that when the child is very active, they say, oh, this boy is, I think this child is ADD. Is it, you know?
Well, yeah. So that is the problem, you know. It can be overused, right? So that's why we need to do the differential diagnosis. There are other conditions like oppositional defiant disorder, ODD. That's ODD, okay? Another DSM-5 criteria, you know.
Okay.
So these children will set fire to the school, will you know, kill a cat, you know. But the ADD child will not do that, right? So we need to differentiate ODD from ADD, you know. So ODD child will grow up with you know, to be psychopath and you know, and they will do all this criminal behavior, but that is another story for another day, right? But ADD is straightforward with their executive function having problem. You know, they are not immoral. They are not you know, having any moral problem in their character. You know, they are not evil. You know, so that is another disorder which is out there as well. Because
I know in school, once a child is very active and they can't sit down, oh, it's ADD, you know, and they are like, you know, don't know what to do. This ADD child, I think, which, you know, I think is very wrong. And, you know, we are not, I mean, I think we shouldn't be, you know, telling anyone or diagnosing any child unless the child goes, am I correct?
Yeah, we need to refer, you know, as teachers, we need to refer them to the therapist, and that's why many of you are getting trained, you know, to do a proper assessment and diagnosis, right? So we need more trained therapists, you know, to do all these diagnosis in the school setting, you know. Definitely, because teachers are not trained to do that. You know, we need to do more talks and training. Certainly, you know, we have done that. Go and give talks, but it's not the part of the training that the teacher receive, right? Yeah. But I agree with you. It's been an overused term. Everything is ADD. It's yeah.
Okay, one more thing.
So much.
Sorry, Doctor. One more thing. Why is it very often we hear of ADD now? Why is there something that children, most of them?
Definitely. I mean, talk about the diet just now, right? We are under attack by McDonald's and or the fast food easy diet, our compared to 50 years ago, our grandparents, that because of all these convenience food out there, right? And the ADD child, even ADD adults, they have this lack of ability to say no, right? They cannot put the brake on. So that is why then they are they feel that they have to ingest all this unhealthy food. Yeah. So there are all sorts of behavior which impulsivity becomes a problem. From driving, there are research showing that ADD, there are more accidents, more parking tickets fine. You go and you cannot find a parking space. The ADD person will go and park anywhere. You create your own space and get the fine. So there's all this problem that pops up more with ADD person because they cannot put a brake on to control. So in one of the past webinar, we talked about borderline personality disorder. Okay, if you remember, I'm not sure whether you were there. Yeah, but this is a very different problem. Okay, with borderline, they have emotional dysregulation. All right, so that means that the emotions is out of normal, right? That they feel too much pain, too much sadness, but not the ADD person. It's a normal amount of frustration they feel, but they just cannot control that. All right, so it's not out of normal emotions of frustration. This is normal amount, but compared to the ordinary person, a normal person,
not able to control.
Yeah, they cannot put a stop there. So they're going to have more accidents, more failed marriages, more breakup, early pregnancy, more more sexual diseases, all this because they cannot control their behavior.
So, Doctor, you agree with me? I mean, if I say, I think when people get married, or it is good to have a sort of training, for them. I mean,
well, another. Yeah, there's a woman who wrote a book that you should check it out. It's called IU or ADD. All right, I think her name is Parry, Pare. Gina Parry. Yeah. So she married the husband who has ADD, and he did not get diagnosed until in his 30s, right? And because of that, they're having big problem, and now she's slowly understanding it. So it can become a real strain in the relationship, for adults, and this need to be understood. It's not because your partner is not empathetic to you. He just cannot remember, and when you say something, right? It's not that he is not attending to you. His attention fly off. He thinks of the next thing, and then he will talk about the next thing, because it's not because he doesn't care about you, but then we feel, as the spouse, that our partner did not care for us. So that leads to a lot of relationship problem, but it is the ADD, right? That is going on.
It will be good for young married couples to actually attend talks like this, because they also learn about their spouse, and also they prepare for their coming child, right?
Yes, yes,
Yeah.
exactly, exactly. That get screened, you know, and also with parenting, you know. So if you
Yeah.
know, of course, the child will love the ADD father or the ADD mother, because that there's like no restriction, that there's like anything goes, you know. So that can become a problem in parenting, right?
Yeah.
One side of parent will be the strict enforcer. The ADD parent would become very permissive, you know. Um,
Non-consistent, right?
yeah, exactly, right. Disorganized, you know. But then they can have the occasional blow up as well, you know. So you have all these problem that gets compounded because of ADD, you know. So there is all these areas in our life that this can affect us, right? Yeah.
Can we open the floor to anybody else who wants to?
Yeah, so anyone can ask any question that anytime you can post in the chat box or ask, you know, directly, and unmute yourself. Yeah, but
Anybody has got any questions? Anything you have noticed in a child or a guy, or I mean, or an adult? To ask? Good chance to ask.
yes, yes, yeah. But we still have some time, so they can certainly ask. So you know, going back to treatment, we have the nutritional part, but there's also the behavioral part, you know. So
So
we
there's,
have, you know,
sorry.
we have like, yeah, we have ways to help parents, right? Ways to have couples to really look at these issues and regulate their
So there's
behavior.
not really one treatment. Okay, you have to test a little bit, a few, to find out the correct treatment. You say that?
Yeah, you need to find out what is the precise um, contributing
Factor.
factor, you know, which part of the neurotransmitters, and if it is imbalance, what is causing it, and then but because of the habits, you know, and maybe all the secondary psychological issues like anxiety, you know, that has been created, depression, self-esteem, all this has been affected over the years. So this need to be treated as well, right? So in psychotherapy we have primary and secondary problems, right? So the secondary problem could be the mood swing, the anxiety, you know, but the primary problem could be the ADD, right? Because that is what causing it. So of course we need to fix both, and we haven't talked about addiction, right? So there are much more addiction with ADD, right? From drug addiction, cigarettes, coke, food, you know, we have mentioned.
Alcohol.
So because they're alcohol, because these are all natural ways the ADD person try to fix themselves, right? So that they find, you know, when I drink, I feel less anxious, or when I, you know, take the coffee, I feel, you know, more energized. So this you know, or the sugar. So these are ways that they do think that to help themselves fix their ADD, you know. So so this high correlation of addiction and ADD, and this is another area, you know, we have a addiction therapy in our courses. So this is where we need to help the ADD person to get treated from the addiction as well, right? And at the same time as working on the ADD, you know. So all these correlated problems need to be treated wherever they are, whether it's anxiety, depression, or addiction, you know. So there are more of these problems, right?
Yeah,
So
there is a question. Somebody's asking a question.
So Aizu, I think is asking the question, yeah, whether the ADD child try to get attention, you know. So like showing the word at the TikTok, you know, apps. Yeah, I mean the, you know, the ADD child might try to you use a lot of negative words, like we mentioned. This child use the F word, you know, a lot, right? Yeah. So they so computer game addiction, like TikTok, you know, I mean, I haven't played TikTok per se, but I heard about it a lot. But I presume it's like any other computer game, you get a reward, right? So this is why the ADD child can be addicted to gaming, right? Because there's an instant reward that they feel, right? So they play, that they get the reward. It is just a way that is more vulnerable for them, right? Because in the normal world, they don't get an immediate reward. Okay, because of this low dopamine. You know, dopamine is a reward pathway in our brain. So when we do things, you know, we get rewarded, then there's a reinforcement to do that. So it's very easy for them to get addicted to games. That is true. Yeah.
TikTok is something that they, I think, you know, with the music or things like that they will record themselves, and, you know, they post it everywhere so that everybody sees those kind of things, you know. Like recently we had one child throwing the cat
right
up in the air. So
yeah, so you might be talking about ODD already, you know. If yes, I mean, you know, that is cruel, and that is you know, you are hurting an animal, and so a pure ADD child do not have that problem. But some yeah, but some children, they are, you know, straying into the oppositional defiant disorder. You know, they have moral challenges, and this is another problem. Yeah, so this is more than ADD, and you know, we can have another webinar in the future to talk about that. But that is a different problem.
Another one I hear, ADD child, it is more the male and than the female. Is it true?
No, there is I mean our brain works slightly differently, but there are like no essential difference that can be you know, based on gender, right? It's not it's not like ASD, you know, where it will affect the male definitely more than the female, right? Yeah, but with ADD, the, you know, we're talking about dopamine, noradrenaline, you know, executive function, all these male and females can be impaired just as much, you know. That there is no
segregation.
Yeah, yeah, it might get expressed a little bit differently, but not that much.
Okay.
Yeah, I think our time is coming up, you know, to a close in this webinar, and certainly we have managed to have some good discussion, on this topic that is affecting us more and more, you know, and more children. So it's good to understand the differences, you know, what is what, to be able to make the differential diagnosis of what is ADD, what is ODD, right? And how that is different from ASD, and all that, how it affects us as adults, you know. So, and there are all these different treatment, from diets to nutritional therapy, you know, even medication and behavioral therapy, you know, all this can have a role, right, in treating this complex. NG say if we play the play therapy with a child, so certainly we would and encourage play therapy. It is bonding, you know. We can look at you know, you bang on the wall, roll on the floor. Well, I mean, if he like keep on hurting himself, that is ASD already, right? So self stimulation, right? So you might be talking about ASD, because ASD children that they like to hurt themselves, you know. But if it's just like to get attention, it might still be ADD, right? It depends on the motivation. Yeah, well, we need to low monitor the behavior, look at the motivation behind it, right? What is he doing it for? Is for attention or for sensation, you know? For the ASD that would do it for the sensation, right? I don't think it's like ODD, because you know, ODD they want to hurt others rather than themselves. So the, you know. But it could be a ASD, right? Where they might have sensory issues, right? And doing it for that. Okay.
So
interesting. Yeah.
That's it for now, I think. Doctor, thank you very much for your valued input and all this on ADD. ADD. Right now they call it ADD only, right? No more ADD.
ADD, well, AD stroke with the H, there's a stroke there, you know. AD stroke H D, right? So that is no worries. Thank you for the nice conversation, Judy, and thank you everyone for participating. We will see you again shortly another time.
Okay, thank you.
Have a safe day. Bye bye.
Bye.
Bye bye.
Bye.